Good morning, everyone. It indeed is an honor to be here and to really meet all of you. I've had the opportunity to talk a lot with a lot of patients that I haven't met before, and it's just been a very rewarding experience. And what I want to do this morning is sort of focus on why you all need to be involved in research. You've heard the background about Pakora, and I want to specifically talk about opportunities for patients to get more engaged in the whole process. Now, why should patients be involved? Well, this slide just really tells you this. You're the patient. You're the patient who has to go through all these different stages of chronic kidney disease. And I'm very happy that there are several patients here that have chronic kidney disease. I met some of you, and I think that's so important for you to be here so that you can benefit from knowledge to help keep you from going to dialysis or transplant, hopefully. So basically, the life of a kidney patient involves several stages, that from CKD to pre-ESRD, and then to where they have to go on dialysis or get a transplant. And within that scheme, you can go back and forth, and many of you in here have had dialysis, you've had hemodialysis, you've had peritoneal dialysis, you may have had 1 or 2 transplants. So it's really a continuum, and that's why it's important for you and other patients to be involved in the whole process. It indeed is your life. And so we talk about in dealing with patients with kidney disease and developing a life plan. And this is something that I think is really helpful from day one when you first meet your kidney doctor, to really go over specifics about what to expect. Because in talking with a lot of you and patients that I interact with, they didn't really know all of the consequences of having kidney disease. They didn't know that once they got on dialysis, that they might have issues with their access, that they might have to go to another type of dialysis, etc. And they didn't really know what things they needed to do to improve their health. So really, I think it's ideal for patients to have a relationship with their healthcare providers and let them know what is important to them. And they need to feel comfortable in doing that. And so one of the ways for patients to really get the word out or get their voice heard is to participate in research projects that they can really illustrate what really bothers them, what they want to see improved about their lives, not just what the medical field tells them that they need to do. So I have highlighted in step 3, ask the patients their goals and priorities, okay? Because that's really what I think we should be focusing on. And then discuss the patient actions that can improve those outcomes. So help you be able to comply or follow treatment recommendations. And these I have listed, and this is really the basis for the patient-centered outcomes, is what are the patient's priorities? What are your perspectives? So quality of life, all of us want to have a good quality of life. We want to have a social life. We want to be able to work. We want to support our families. We want to be there for our families. We want to see our children and grandchildren grow up. We want to participate in their activities. And we want to feel better. As far as dialysis patients, the ultimate goal is to get a transplant. And I know we have a lot of transplant patients here. And then you want to live a long time. I mean, many of you have heard about the shortened lifespan of patients with kidney disease, especially on dialysis. And so you need to be engaged in the process to help us learn better ways to help improve your life expectancy. Now, I have listed here sort of traditional medical research that usually occurs in kidney patients. And these are things that you all, if you've been on dialysis, you have your monthly lab report, right? So these are all things that you get kind of graded on. And you know a lot of these numbers. So you want to make sure your hemoglobin is good. You want to make sure your cholesterol is good. Calcium, phosphorus, PTH, that dreaded KT over V. Everybody knows what that KT over V is. That affects how long you have to stay on dialysis, or if you're on peritoneal dialysis, you may have to do an extra exchange, etc. And then blood pressure. So those are all things in the medical community that you continue to see studies on. But unfortunately, a lot of the studies that have been conducted in dialysis patients haven't all that been, effective or actually really positive results, or things that are life-changing. I think we want to focus on those things, and we want to do everything we can to improve your health, but nothing's been sort of, earth-shattering. It's not any major changes in the whole dialysis treatment paradigm. So that's why you've heard a lot at this meeting about innovation, and I think there needs to be a lot more new research and methods to treat patients on dialysis. The other important point of this, too, is that if patients are given the support that they need to be able to achieve all of these goals, the studies really don't matter. If you can't control your calcium, phosphorus, because you have issues getting your binders, you can't get your blood pressure medications. If you're a transplant patient, you can't afford your transplant medications after Medicare stops coverage. And so those are all things that need to be addressed and for patients to get effective treatment from the medical studies that we do have. So Pakora, I think, has really been, a big changer in the field of improving care of patients. And you've already heard an excellent background of what Pakora is. And I want to tell you about some of the specific projects that Pakora has funded, and namely a project that we have received funding for through AAKP, and that we will be soliciting your help with. I've had so many people talk to me and say, I want to get involved, I want to do more than what I'm doing, I want to help other people. And so this is going to be a great project for everyone to get involved with. As Diana mentioned, we have a grant that just got funded really a month or two ago called Empowering Patients on Choice. I'm sorry, that's not the name of the project, but it's based on some other previous funding projects, and one is called Empowering Patients on Choices for Renal Replacement Therapy. And these papers that I'm going to highlight are referenced and published in mainstream medical journals. So these are things that your doctors are reading. So the word is getting out that research needs to be more patient-focused. I've heard a lot of people say, well, I can't get what I need from my doctor or my healthcare team. They're telling me about my labs, but they're not talking to me about my personal issues, how I get up every day and come to dialysis, and how I can't work, and those types of things. So believe you me, your voice is being heard, and it will continue to be heard, but you have to get the voice out. You have to speak up. You have to encourage your other patients in your centers to come to this conference or to get engaged in whatever activities. It's great to see all of you here. You're very engaged, but there's thousands of more patients that aren't being reached. And so the focus of Pakora And particularly our project is to help reach those unengaged patients. So this particular study that was just published, there was 2 questions that they asked patients. One was, how do you cope with your kidney problems? And secondly, what bothers you the most about having kidney disease? And so as far as what the patients answered about coping and what bothered them the most was the time spent on dialysis. How many can attest to that? Diet restrictions, I probably get more hands for that one. Inability to travel, the lifelong, incurable, and fatal aspects of your disease. Lack of control. You can't control what happens. You can't control how your kidneys progress. You can't control what happens once you're on dialysis. And then the limited treatment options. So I'm sure everyone in here can witness that they've thought about all of these things as things that bother them about having kidney disease. So what they did is they sort of compiled all of the responses and came up with and used something called a coping strategies index. And so they sort of defined or categorized patient responses according to their answers to those questions. And they came up with 2 major sort of categories. One is engagement, meaning the patient is engaged and accepted their disease, and they're dealing with it the best they can, using cognitive structuring, problem solving, social support, and ability to express their emotions. Now, there were some patients who used disengagement strategies where they avoided the problem. They sort of said wishful thinking type things, like they really haven't accepted it. And social withdrawal, i.e. they're saying, I don't need any help, I can cope with this, I'm not going to worry about it. So as far as what types of responses, according to the types of patients, the ones who didn't have a lot of other chronic conditions, i.e. they didn't have heart disease, diabetes, heart failure, they were more likely to rely on engagement strategies where they had positive responses to their disease. Those with kidney disease for at least 6 years or less were less likely to use disengagement, meaning they were more engaged. And that makes sense, right? The longer you've had a problem, you learn to accept it. So really the patients who had just been diagnosed within a year or so were the ones who were more likely to be disengaged, as well as chronic kidney disease patients, advanced stages 4 and 5, before they got on dialysis, because they just haven't accepted the reality that they have a kidney problem. And that's why it's so really good to see people here at this meeting wanting to learn about chronic kidney disease, because it is something eventually will progress. And the best way to slow that progression is to deal with it early rather than late. Some of the engagement strategies were, I can take care of myself, I accept it, but I'm going to keep going. I'm going to follow the doctor's orders. I'm going to rely on my family and friends for support. So those were all the positive engagement strategies used. The authors in this paper concluded that patients with those attitudes, which I know is most of you in this room, suggest that these patients would be responsive to opportunities to improve self-reliance if they had more structured and systematic support from healthcare providers and social services to address their quality of life and thus better patient-centered health outcomes. So they took this as a way to say, we need to do better to give the patients what they need. They do want to do better, but they need more help. They need more support from their healthcare providers. Now, for the patients with disengagement issues, these were patients who, again, said, I'm okay, I don't need help. Can you guess what group of patients were more likely to have these strategies? I'm talking about not necessarily disease process, but types of people. I'll give you a clue, male versus female. Right. The males were more likely to say, and we all know this, right? We always say this, that the men may not want to go to the doctor like they should, those types of things. And so they were more likely to say they didn't need help, they would be okay. But the point is if you knew what those patients' coping strategies were, that you could better direct them to get the help and support that they need. So their summary was that the providers could be more vigilant and proactive in suggesting engagement strategies, such as encouraging them to go learn more about their disease, participate in any type of support groups that are available, and talk to other patients. And that's going to be sort of the focus of the rest of my talk, is about the importance of patient and peer mentorship to help patients adjust and have appropriate coping strategies. So solutions to improve coping skills, first and foremost, is referral to other patients with similar experiences. I can stand up here all day and talk to patients about their disease, but I have not personally gone through it. It will help you to talk to someone who actually has felt the way you feel. And so that's the whole point of our project that I'll talk a little bit more about. Another thing, and I actually got one of these suggestions from one of you in one of our lunch groups, is giving education at the proper time, that you have a proper mindset. So if you wait until a patient is on dialysis and they're in-center dialysis, they get comfortable with someone else taking care of them, they're not as receptive to hear about home dialysis, or that they would now be responsible for doing it at home. So really the opportune time is before the patients start dialysis, if we're talking about trying to get on home dialysis. And then also other things about dealing with their disease. A lot of times patients get on dialysis and they give up. And they just say, oh, I just feel bad, I can't do anything, but if you're prepared before you start dialysis, maybe you might do better on dialysis. And then more time and effort focused on meeting patient needs, a trust factor. You have to be able to trust your healthcare providers that they have your best that they are concerned about you as a person. Better communication. I've heard several stories about sometimes the patients don't feel comfortable talking about all of their problems in the healthcare setting. And also even in the dialysis unit, you're sitting next to other patients, and then, people come and ask you questions, and you may not want everybody else to know your business, right? So those types of things, just the whole way that the whole dialysis sort of process is set up is not ideal to help patients really address issues they really need to. This was actually a quote from a patient at one of my centers. We did a study and asked about their preferences about dialysis, and they expressed a preference for a more personalized care and pushing back against a dialysis practice that's designed to be automated for maximum efficiency. And this statement was so enlightening to me. They said that the patient said that while they're dialyzing in their chairs, they're 6 feet apart, and you could hear the same thing discussed with each patient. You know, they're going over their labs, etc. And they described it as a drive-by assessment. And then you move on to the next and the next, like a one-size-fits-all approach. And then if I really think about it, that's what goes on in a lot of dialysis units. And the patients need more time. They need more privacy. They need more one-on-one approaches to really improve their care and make them feel more engaged as well. Now, I just have a slide about home dialysis. I know there's several home dialysis patients, or you've been on home dialysis. And this was a paper that we published a couple of years ago. And it's just showing you sort of the national rates of patients on home dialysis. And this is particularly, the first column is PD, is peritoneal dialysis, and then the third column is home hemodialysis. And we know in general that home dialysis across the United States is really about 11 to 12% of the whole dialysis population. But you can see I have it broken down according to race, and the African Americans are at the bottom. So there are 6% likely to be on peritoneal dialysis compared to 11% of whites, and then Asian and Hispanics are in between. And then for home hemodialysis, I mean, overall, I would say the population in the US is about 2% of people on home dialysis. It's harder to determine any disparities in that because the numbers are so low. So what about home dialysis? What about types of dialysis? So Pakora has a project, the Empowering Patients on Choices for Renal Replacement Therapy. So they asked existing dialysis patients, did they choose the type of dialysis they were on? And so when they asked the peritoneal dialysis patients, 95% said, yes, I chose this type of dialysis. And they cited reasons why they chose peritoneal dialysis. Well, I hear a lot of bad things about hemo. I don't want to do that. I can have a better quality of life. I can work, and it's more convenient. For the in-center hemodialysis patients, 47% said that they chose to be on hemodialysis. So that means 50+% were just told or referred to an in-center dialysis unit. Okay, so that's a major problem because they didn't really have a choice. And they also cited the reasons why they stayed on hemodialysis, because they were afraid of getting infections with PD, and we know that that does exist. But many of them didn't even know they could do home hemodialysis. And then they got comfortable in center, so they felt like they just wanted someone else to do their dialysis. They didn't want to be responsible for it. So again, it sort of speaks to the fact that these patients need to be given a choice earlier for their therapy choice. Now, in contrast, this is a survey of doctors and nurses and asking them what type of dialysis they would choose if they had to go on dialysis. And you can see 90% of them chose home. okay? But yet 50% of the in-center patients are told to go in-center. And so these are things that we definitely need to improve on and get the word out and get the patients educated about what their choices are. They cited important factors in choosing the type of dialysis, obviously independence, flexibility, and quality of life. Now, this is a scale that you all can use. This is on the web. The website is choosingdialysis.org. Okay? And if you're a nurse or healthcare provider, especially in your clinics, or you want to or talk to other patients about what type of dialysis they should do, this is a good tool, and we're going to be using this also in our Pakora project. So some of the questions are, what matters to me for this decision? And so one thing is having someone else in charge of doing my dialysis. So if you choose that, you'll move that bar in the middle to the right. If you see your healthcare team, if you want to see your healthcare team often, if you have ability to go to work or school, so you really rate your priorities. Having a flexible schedule, having social support of other patients. There are some patients who like to go to dialysis. It's a social event, right? And there are some people that's important. But there's other patients who may want to be flexible, they want to work, etc. They want to travel, and they want to provide care for themselves at home. So basically, you would rate each of these questions, and then the bars on the right are going to tell you what's a better fit for you. So it's really a decision guide to takes into account your preferences and not just what the doctor tells you to do. And then you decide, I think I'm a better fit for home dialysis. And then you tell your doctor or nurse that that's what you want to do. And that's the website there, for choosingdialysis.org. And that's the paper reference. Now, how do we get more patient engagement? Obviously, all of you are here because you're engaged, but like I said, there's patients who need to be here that aren't. So we definitely need more patient-centered research that addresses patients' concerns and includes the patients in the design of the studies, i.e. Pakora. We need to develop more patient advocates and ambassadors to mentor other patients with similar experiences. And we need to have patient focus and support groups to really get your opinions about what should be done. Now, I want to highlight one statement I said, with similar experiences. So what we learned, or what was learned from that coping strategies index, that patients have a different level of coping depending on their experience. So those who have been on dialysis for a longer period of time cope differently than those who had just been on for a year. So our goal is to match patients with those types of things in mind. Also, home dialysis patients cope differently from in-center patients. So we want to match patients as much as we can with a person who has similar experiences so that they can actually more realistically be an effective mentor. So Pakora in AAKP, as Diana mentioned, our project is enhancing patient engagement through peer mentoring to improve outcomes in chronic kidney disease. So now, this study is going to address the spectrum of kidney disease. So we have advanced chronic kidney disease, stage 4 and 5. We have dialysis patients, in-center, home, and then we have transplant. So it's going to encompass the whole spectrum. And so we're going to deal with coping strategies, matching similar patients. And then we're going to also focus on education about home dialysis and transplant. So I've already talked to a number of you who want to be involved, and we definitely will need your help when we get the study formally studied. The study is going to focus having a steering committee. Some people can be on the steering committee, and we want it comprise majority patients, because again, it's a patient-driven study, and we want you all to be involved with the design and how we approach patients. And we're using the AAKP ambassador sort of platform to conduct this study, and so many of you are already ambassadors. We're planning on training more ambassadors specifically to be involved with this project. And we want to learn the best practices to reach the unengaged patients. That's really the whole point, is the people who need to hear this are not hearing it. They're not getting, the information that they need. So we want strategies to reach these patients. And so by using the AAKP ambassadors, we're going to have you assigned to a number of patients, and it's going to be your responsibility to contact them. You can meet them wherever they are. We can't expect the patients to go to a seminar or go to a class. We want to meet them where they are because we want to reach them. And so we're developing all of these processes, and we want everyone's input on how to do this effectively. And then, so again, for the patient is in the center. And that's what I think we need to all remember, especially the medical healthcare profession. And I applaud Pakora for realizing that and supporting studies so that we could better reach patients. And then this is the last slide. Patients engaged in their own care have better outcomes, and there are several studies to support this, and that's the message we want to get out. I have my email address there for you to contact me if you want to be involved or have questions.